Hi students, today we are going to see some interesting topic, and that is the cranial nerves and its functional components. Usually students get confused with this topic. Now we'll see, let me try to explain in a brief way. Okay, right? So this is the skeleton, and here you can see the muscle. So obviously it is attached to the skeleton. That's why it is called the skeletal muscle, right? And here if you see, this is the viscera. Okay, stomach is a viscera. So the muscle which is attached or which is present inside the stomach or any other viscera, it is called as smooth muscle. And here if you see, some glands are there, that is your salivary glands. The parotid, submandibular, all these salivary glands, they secrete saliva, and the saliva is excreted and it is transmitted through the duct, isn't it? So here also we do have some secretions. These secretions are ejected out. These are also we do have some type of smooth muscle cells here. So these two comes together. Okay, this smooth muscle as well as the glandular structures. So we saw something called the skeletal muscle, something called the smooth muscle, which is present here in the viscera as well as here with the glands. Now the next entity is, you have seen the branchial arches or branchial arches or pharyngeal arches. It means in our body we do have 6 pharyngeal arches, and the fifth one disappears, that is the embryology part. But wherever the muscle arises from the pharyngeal arches, for example, first pharyngeal arch means mandibular nerve. So the muscles of mastication arises from the first pharyngeal arch. So all those muscles, second pharyngeal arch means facial muscles. Like that, whatever the muscles which are arising from the pharyngeal arches, it is known as general visceral efferent. So we have some terminologies. We'll see all the spinal nerves, they do have these terminologies. General, this is called somatic, and this is called efferent. First the student should know what is called efferent and what is called efferent. Efferent is which is going and supplying a muscle, that is called as efferent, and afferent is purely sensory, which is coming from some areas towards the central system. So you should know that efferent means it is going out and supply something. Afferent means it is coming inside, it is like a sensation, right? So this is the basic thing. And somatic means body wall, and visceral means viscera. Viscera means organs, and here also somatic and visceral. For example, it's general somatic efferent. Somatic means, I said, body wall. So body wall means a muscle which is attached to the skeleton. That means it means muscle supplies the skeletal muscle. So this is somatic means body wall. Body wall means skeletal muscle. Visceral means, just now I said, it is related to the smooth muscle. So general somatic efferent means it should supply the skeletal muscle. General visceral efferent means it should supply the viscera. And then general sensory somatic efferent means from the body, from the skin all over the body, the impulses are coming. That is called general somatic efferent. But general visceral efferent means from the organs the sensation is coming. Understood? So hope you understood this terminology. This is for spinal nerves. And for the cranial also, we do have all these 4 terminologies. Along with that, we have some separate special terminologies, that is called as special visceral efferent. What do you mean by the word special visceral efferent? It is not general. It is something special. Something special means they don't arise from the structures called as myotomes. Usually all the muscles, they arise from the myotome. Myotome means, that is the embryology, myotome. But here something I said previously, something called as pharyngeal arches. You have 6 pharyngeal arches. If a muscle arises from any of these 6 pharyngeal arches, it is something special. It is not general. So it is called as special visceral efferent. So it supplies the structures derived from the branchial arches. And special visceral efferent means from the arches, that what are the derivatives. For example, first arch and third arch, they join together and forms the tongue, development of the tongue. So sensation from the tongue, it is taken from the special visceral efferent. And special somatic efferent means it is something special, not a common organ. Somatic means I said it is attached to the body wall. It supplies a structure which is attached to the body wall. That is called as special somatic efferent. Now let me give you one example. That time you will understand in a better way. And we are going to the first one. We do have 12 cranial nerves. So I am going to talk about the first cranial nerve. Everybody knows the first cranial nerve is olfactory nerve. Olfactory means it is smell. It is related to smell. So smell, nobody is going and supplying the smell. Smell is a sensation. So sensation means it is coming from the nose. So it is coming from the nose means it is afferent first. So this is afferent, and the nose is present inside the body. Okay, and it is related to the one of the important organ which is attached to the body wall. So it is called somatic, and it is not a common sensory like your skin. So it is something special. So it is called. That's why the important tract which is related to is special somatic afferent. This only denotes the olfactory. Understood? Next I'll move on to optic. Optic is also something special which is not common like skin. So it is special, and the optic disc and optic nerve is attached to the orbit. Orbit is body. So it is somatic, and the sensation is coming. So it is called afferent. So special somatic afferent. Next third, it is an interesting area, oculomotor. Oculomotor means it supplies the extraocular muscles, number one. So extraocular muscles means all the muscles are attached to the body bone orbit. Okay, so it is efferent because it is going and supplying the muscle. So these extraocular muscles are all skeletal muscles. So it is somatic. Somatic means skeletal body wall, and it is general. Okay, general somatic efferent. It is not special. So it is general somatic efferent. And then if you see the light reflex and the accommodation reflex, it is related to the lens and ciliaris muscle, dilator pupillae and sphincter pupillae. Dilator pupillae and sphincter pupillae are not attached to the any bony skeleton. So they are attached to the lens and the sclera. So what happens? These are all called as reflexes, it should not be called as skeletal muscle. This is related, dilator pupillae and ciliaris are related to the smooth muscle. So smooth muscle means visceral. So general visceral efferent. So it is supplying the muscle, that's why it is called as efferent, and it is not a skeletal muscle, this is a smooth muscle, that's why it is called as visceral, general visceral efferent. Understood? So this is about the oculomotor. Then we'll move on to the next one, trochlear. Trochlear is superior oblique. Okay, it supplies a muscle called superior oblique, SO4. So the mnemonic is SO4 and LR6. LR means lateral rectus 6. So SO means superior oblique. Obviously this muscle is also attached to the body orbit. So orbit muscle means efferent, and it is attached to the bone. So it is skeletal. So somatic, and it is general, of course. So general somatic efferent. And the next one, we'll move on to the fifth. So only 6 nerves I am going to talk to you in the first video. Second video we'll talk about the rest 6. Okay, trigeminal. Trigeminal, if you see, you have ophthalmic division, maxillary division, mandibular division. Ophthalmic division goes to the ophthalmic division is related to the cornea. Trigeminal is mainly sensory, majority sensory. Sensory means sensation from the cornea is taken. So from the cornea, it is not supplying any muscle, only the sensation. So it is afferent. And then second is cornea is present inside the eye. So it is somatic, body wall. And then it is general, obviously, nothing special in that. So general somatic afferent. And maxillary is also same thing. It supplies the paranasal air sinuses area, nasal cavity, those areas. So it is also, the sensation arises from those areas. So trigeminal is sensation mainly. So that is afferent sensation, and it is present in the body. So somatic and general somatic afferent. And mandibular nerve, third important nerve. Mandibular nerve is very important. Mandibular nerve supplies most of the muscles of mastication. Muscles of mastication and mandibular nerve are derived from the first arch. So first arch means first branchial arch or first pharyngeal arch. Already I told you, if a muscle is derived from the first pharyngeal arch, it should come under special visceral efferent. It should be called as special visceral efferent. So this mandibular division alone, it is called as special visceral afferent. And of course mandibular division, few are sensory, so that is named as sensation it carries. So afferent, general sensory, general somatic afferent. Understood? So this is a very important MCQ which is asked in many of the competitive exams, mandibular division. And the last is the lateral rectus, sixth nerve. Sixth nerve, already I told you, it is related to the bony orbit. So obviously muscle, so it is afferent, and it is bony orbit, skeletal muscle, that's why somatic, general. Understood? That's all about that. So if I ask a common sense question, among the 1 to 6th cranial nerve, which cranial nerve alone is derived from the pharyngeal arches? Obviously the answer is which one? 1 is not, 2, 3, 4, 5, 6 we have done, and the fifth only one is something different, that is your mandibular division, because mandibular division arises from the mandibular muscles of mastication, derived from the first arch. So pharyngeal arch, if it comes, that alone is coming from the special visceral afferent. This is a very important MCQ. Rest everything is very simple. So we'll meet you in the next video.